In my previous videos, I've already covered the topic of questioning the number of deaths from COVID-19, beginning with a statement made by Dr. Walter Riccardi, science advisor to the Minister of Health in Italy. And again, I'm going to quote him here. He said, "The way in which we code deaths in our country is very generous in the sense that all the people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus on re-evaluation by the National Institute of Health. Only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity. Many have two or three," he says. Which means that Italy's death toll for coronavirus isn't truly what we've been told via sources such as the Johns Hopkins website. This misleading way of calculating deaths has also been called out by Professor Dr. Sucharit Bhakdi in Germany. Now, we believe it's also being applied around the world, but to what extent is not clear. But now we're seeing more doctors coming forward to call this method out. And I've also obtained the CDC guidance on how to classify COVID-19 deaths in the United States. I'm going to go through that also. First, we'll begin with a talk given by Dr. Annie Bukacek. She's a board-certified internal medicine physician. She's recently explained how COVID-19 death certificates are being manipulated.
To drive this home, we need to understand how the CDC and National Vital Statistics System are instructing physicians to fill out death certificates related to COVID-19. The assumption of COVID-19 death can be made even without testing. Based on assumption alone, the death can be reported to the public as another COVID-19 casualty. The March 24th, 2020 National Vital Statistics System memo states, and I quote, "The rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not."
Well, it's almost like they want COVID-19 to show up on death certificates, and they've devised a system to achieve that as often as possible.
The CDC report of cases in the U.S. memo from yesterday states the death numbers are preliminary, quote, and have not been confirmed. So, quote, "The results are preliminary and have not been confirmed," end of quote.
Interesting. And yet the media reports on them as if they are confirmed.
Stephen Schwartz, National Director of the Division of Vital Statistics, says in answer to the question as stated in the organization's COVID-19 alert, quote, "Should COVID-19 be reported on the death certificate only with a confirmed test?" Check out his answer, and I quote from this memo, of which I have a copy, quote, "COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death."
Emphasis on the word assumed.
Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc. End of quote. I'm sure you all feel so reassured the government is asking doctors to provide their very best guesswork.
By the way, I'm going to be going through some of the document that she's referring to later on. If you want to watch her full speech, I'm going to include it linked below. The full 17-minute speech can be found on the Liberty Fellowship YouTube channel.
Quote, "COVID-19 caused death," end of quote, and quote, "assumed death by COVID-19," end of quote, are not the same thing. And for those who died from something else and had an incidental finding of COVID-19 positivity, dying with COVID-19 is not the same as dying from COVID-19.
Exactly. In my last two videos, I've given you several examples of how the media has run with stories of people dying with COVID-19, but not as a result of it, and how it was later revealed that more investigation was needed before the deaths could be confirmed. I'll include those two previous videos linked below for you to check out.
To reiterate, if a patient tests positive for COVID-19 and dies from another cause such as pneumococcal sepsis, it may be considered accurate to say that person died with COVID-19, not from COVID-19. Yet the CDC guidelines list they list this case as one more COVID-19 death, and they go to the next questionable death. They label that as COVID-19, and it goes on and on.
At this point, there's just no way of knowing for sure just how many times death certificates have been manipulated in this way. And yet, if this practice is so common, then our governments have been implementing social distancing, lockdowns, and economic shutdown policies based on death rate data that is now being seriously called into question. But more on that later.
You could see how these statistics have been made to look really scary when it is so easy to add false numbers to the official database. Those false numbers are sanctioned by the CDC as of their memo yesterday, April 4th. I have made physical copies of those memos in case more people start looking at their website and they decide it's too much truth for us. I hope I was able to make my point. The real number of COVID-19 deaths are not what most people are told and what they then think. How many people have actually died from COVID-19 is anyone's guess. Again, God only knows. But based on how death certificates are being filled out, you can be certain the number is substantially lower than what we are being told.
Exactly. It's just like what Dr. Walter Riccardi said. The death toll in Italy from COVID-19 may only be 12% of the reported figure. How do we know that the death tolls in other countries aren't also as low as that?
Based on inaccurate, incomplete data, people are being terrorized by fearmongers into relinquishing cherished freedoms.
Now, let's take a look at this document. Vital Statistics Reporting Guidance. Guidance for certifying deaths due to coronavirus disease 2019 COVID-19. In Part 1, it says, Part 1, this section on the death certificate is for reporting the sequence of conditions that led directly to death, the immediate cause of death, which is the disease or condition that directly preceded death and is not necessarily the underlying cause of death, UCOD, should be reported on line A. The conditions that led to the immediate cause of death should be reported in a logical sequence in terms of time and etiology below it. The underlying cause of death, which is A, the disease or injury which initiated the train of morbid events leading directly to death, or B, the circumstances of the accident or violence which produced the fatal injury, should be reported on the lowest line used in Part 1. Sounds fairly reasonable. Now, the conclusion is where things get interesting. An accurate count of the number of deaths due to COVID-19 infection, which depends in part on proper death certification, is critical to ongoing public health surveillance and response. When a death is due to COVID-19, it is likely the underlying cause of death, and thus it should be reported on the lowest line used in Part 1 of the death certificate. Ideally, testing for COVID-19 should be conducted, but it is acceptable to report COVID-19 on a death certificate without this confirmation if the circumstances are compelling within a reasonable degree of certainty. So that last sentence is interesting. It's not necessary to test for COVID-19 to report it on the death cert. So there's a little bit of guesswork here. There appears to be a bias in the certification for COVID-19 deaths, which is to say the reporting is sufficiently broad that COVID-19 can be placed on any one of these four lines, A, B, C, or D, as a primary or possibly contributing cause of death, whether testing is done or not. Does this mean that when COVID-19 shows up on any one of these lines, that the death could be recorded in the official death stats for that region as a COVID-19 death? Dr. Scott Jensen has more on this on KX4 News.
You just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning. And it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor.
So let's move on. This article is from Zero Hedge. In March, US deaths from COVID-19 totaled less than 2% of all deaths. About 2.9 million people die in the United States each year from all causes. Monthly, this total ranges from around 220,000 in the summertime to more than 280,000 in winter. So this is important. In order to know if COVID-19 is truly as serious a virus as we're being led to believe by politicians and the mainstream media, we need to know if there's been a noticeably significant increase in the total number of deaths across the world, per month, per quarter, and then eventually per year, for all countries. The US would of course be a good indicator. How many people die per day? Is there a portion of daily deaths being apportioned to the COVID-19 death column in order to drive the numbers upwards? In recent decades, flu season has often peaked sometime from January to March, and this is a major driver in total deaths. The average daily number of deaths from December through March is over 8,000. So far, total death data is too preliminary to know if there has been any significant increase in total deaths as a result of COVID-19, and this is an important metric because it gives us some insight into whether or not COVID-19 is driving total death numbers well above what would otherwise be expected. Indeed, according to some sources, it is not clear that total deaths have increased significantly as a result of COVID-19. In a March 30th article for The Spectator, former UK National Health Service pathologist John Lee noted that the current number of deaths from COVID-19 does not indicate that the UK is experiencing excess deaths. Lee writes, the simplest way to judge whether we have an exceptionally lethal disease is to look at the death rates. Are more people dying than we would expect to die anyway in a given week or month? Statistically, we would expect about 51,000 to die in Britain this month. At the time of writing, 422 deaths are linked to COVID-19, so 0.8% of that expected total. On a global basis, we'd expect 14 million to die over the first 3 months of the year. The world's 18,944 coronavirus deaths, this was at the time, represent 0.14% of that total. These figures might shoot up, but they are right now lower than other infectious diseases that we live with, such as flu, not figures that would, in and of themselves, cause drastic global reactions. How do these numbers look in the United States? During March of 2020, there were 4,053 COVID-19 deaths, according to Worldometer. That is 1.6% of total deaths in March 2019. Total data on March 2020 deaths is still too preliminary to offer a comparison. For context, we would note that total deaths increased by about 4,000 from March 2018 to March 2019. So for March, the increase in total deaths is about equal to what we already saw as a pre-COVID increase from March 2018 to March 2019. As Lee notes, total COVID-19 deaths could still increase significantly this season, but even then, we must ask what percentage of total deaths warrants an international panic. Is it 5%, 10%? The question has never been addressed, and so far, a figure of 1% of total deaths in some places is being treated as a reason to forcibly shut down the global economy. Precisely. I'm not saying the virus doesn't exist or anything, I believe it does. But to what degree is it deadly, and what amount of deaths would justify these draconian lockdown measures and social distancing? In other words, are we in fact overreacting? Update. Meanwhile, the CDC is instructing medical staff to report deaths as COVID-19 deaths, even when no test has confirmed the presence of the disease. In a Q&A on death certificates published by the CDC on March 24th, the agency advises. Now, at this point, the article goes on to make reference to this document from the CDC from March 24th. Look at this line. Will COVID-19 be the underlying cause? The underlying cause depends upon what and where conditions are reported on the death certificate. However, the rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not. Well, there you have it in black and white. They're expecting COVID-19 to show up as the underlying cause more often than not, whether it's the assumed underlying cause or the main cause. It's considered to be a death by COVID-19. Should COVID-19 be reported on the death certificate only with a confirmed test? COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Emphasis on that again. Or is assumed to have caused or contributed to death. It's almost as if they're trying to encourage the phrase COVID-19 to be used as often as possible on death certificates. The Zero Hedge article continues. This is extremely likely to inflate the number of deaths attributed to COVID-19 while pulling down deaths attributed to other influenza-like illnesses and to deaths caused by pneumonia with unspecific origins. This is especially problematic since we know the overwhelming majority of COVID-19 deaths occur in patients that are already suffering from a number of other conditions. In Italy, for example, data shows 99% of COVID-19 deaths occurred in patients who had at least one other condition. More than 48% had 3 other conditions. Similar cases in the US are now likely to be routinely reported simply as COVID-19 cases. Until we have reliable numbers on all deaths in coming weeks, it will be impossible to know the extent to which COVID-19 are cannibalizing flu and pneumonia deaths overall. That is, if the COVID-19 totals skyrocket, but total deaths remain relatively stable, then we might guess that many deaths formerly attributed simply to pneumonia or to flu are now being labeled as COVID-19 deaths. Potentially, this could also be the case for other patients, such as those with advanced cases of diabetes. By the way, Dr. Birx of Trump's COVID-19 task force recently said the following.
There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? You hear from coroners that that's not necessarily the case. Are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections and things?
Yes, we need to have a serious discussion about how this reporting is skewing the numbers. All the information I've discussed here is publicly available. So, out of what appears to be fear, a bit of paranoia, and a massive chunk of the population becoming overly emotional and hysterical about this to the point where it's very difficult to reason with them, people still continue to consume the mainstream media fear porn and go along with it. It really is like a spell has been cast, like mind control. As David Sutcliffe writes, remember when everyone knew pro wrestling was fake? And they finally admitted it, and the fans didn't care and continued to watch anyway? We're almost there with politics and the media. Exactly, well said. People have sacrificed their businesses and livelihoods. Millions have lost their jobs based on computer models and projections for the virus that have proven false. And now, questionable death certificate data that is massively inflating the death rate. And we're headed for a massive economic depression, which will be way worse than the virus itself, I suspect. Economic collapse means poverty, much lower standards of living for the general population. That means lower life expectancy for a myriad of reasons because the healthcare system will be depleted. That means more disease. There will be massive social issues, depression, sky-high unemployment levels, and I could go on. That's what global economic depressions look like. The populace at large are completely ignorant to what's happening and still think the virus is the problem. All their rights are gone, and they're cheering this on. They seem to want more government oppression. They're cocooned in their homes. People are snitching on each other, and they're being encouraged to do so.
We need to make sure that everybody continues to let us know where those folks are. If you've observed recurring violations of the Safer at Home order, please continue to let us know at coronavirus.lacity.org/business violation. You know the old expression about snitches? Well, in this case, snitches get rewards. We want to thank you for turning folks in and making sure we are all safe.
This is terrifying. It's as if we're being primed for an entirely new type of society. Look, I still think that the elderly and vulnerable should be protected and isolated from this virus as best as possible because they're the ones who are most at risk from it. But this has to be done voluntarily. It's something that families should and can take care of themselves. These are personal and private choices to make. I don't believe that the lockdown was the right choice, and I think there's many an agenda behind it. It's not for the government to take everybody's rights away, supposedly for their own good. So, in conclusion, I will have further reports for you in the coming days, more analysis, more investigations into what's going on, and hopefully a more fuller picture of why. There's plenty of very compelling theories. I think this is about forcing a new social and economic paradigm upon the masses, a new global financial system, and they're gradually acclimatizing us to it through these forceful tactics. I'll be presenting more information as it comes and as we continue to explore this situation together. So I advise people keep questioning everything, keep up your own investigations because we're all citizen journalists in this now. Keep your eyes open, keep sharing the word to those around you. Thank you very much for watching, and I'll catch you next time. Bye-bye.